Good afternoon, Nevada, and my fellow Nevadans. I'm standing here before you today because as this situation develops, we must evolve with it. We must grasp the gravity of the reality that we find ourselves in as we battle our invisible enemy, COVID-19. This is a pandemic of devastating proportions, and we need to respond with the appropriate decisive measures. On March 5th, we had our first presumptive positive case of COVID-19. On March 17th, when I urged businesses to close their doors, we had 64 cases. Today, we have now skyrocketed to 109 cases. Our positives have gone up 70% in 3 days, and one of our own Nevadans has died. And because this developed in other countries and states before arriving in Nevada, we didn't have to guess at what comes next. The rapid increase in positive cases will continue. The numbers aren't slowing down. We have not yet reached our apex. And like other states, we don't have enough test kits to know the full scope. Test results are only a snapshot of how many tests are completed. They do not account for all those that are likely walking around with this virus, who don't even know it because they aren't showing symptoms yet. And despite countless calls and around-the-clock work to push for and even beg the federal government for additional test kits and supplies, the Nevada Division of Public and Behavioral Health received a notice yesterday that all of Nevada's requests to the federal government regarding drive-through swab testing pods, swab test kits, and testing reagent kits are on an indefinite backlog without any estimate of a timeline for delivery. This is our unfortunate reality, Nevada. It's up to us. While we look to access federal and state resources, I also know that when I make more calls over the coming days and ask for support and resources from our community partners, I know you will step up. The state's Health and Emergency Management Team is moving forward to protect public health through every appropriate means at their disposal, including by accessing the open market. I am thankful for the hardworking and brilliant doctors working in the Nevada Health Response Medical Advisory Team who support these measures. While not a silver bullet, these moves will help us get a better picture of the totality of this crisis. The more cases we can identify, the better we can treat them and save lives. If history has taught us anything, it's that times such as these require real leadership. I might not be the best public speaker, and I'm not certainly as polished as the politicians we see in the movies. But here's what I can offer to my fellow Nevadans as we deal with this crisis. I will be honest with you. I'll tell you the facts and deliver the good and the bad news because I think you can handle it and you deserve it. That's the people of this great state, that the people of this great state will remain my North Star as we navigate this uncharted territory and face painstakingly difficult decisions. And that your life and the life of your neighbors and family members will always be more valuable to me than a perceived and mistaken economic gain we'd have by cutting this isolation period short or by waiting one more day to get serious. Waiting one more day to begin taking serious action to mitigate this virus is one more day of Nevadans getting sick and dying. And if someone is telling you otherwise, they are either mistaken or recklessly incorrect. And while I'm so proud of all those who put their state before themselves and committed to stay home for Nevada, we know that not everyone is stepping up. And for those of you who've reached out frustrated that certain business or leaders are endangering your families with their reckless decisions, I agree. And as our cases increase and our situation becomes more dire by the hour, I will continue to face the challenge head on with more drastic measures than I had previously anticipated in order to protect all Nevadans. I'll meet this moment, and as I explained in a moment, I'll do it by being aggressive and making the tough choices. But first, let me start by laying out our situation in the most honest possible way. This virus is going to get worse before it gets better. Like so many other states, Nevada's health system will not be able to handle an excessive increase in patients all at once without rapidly straining resources. And without aggressive mitigation efforts, an outbreak can turn into a full-blown crisis that will overwhelm our hospitals, put our healthcare workers at a higher risk of exposure, and test the limits of our medical system. Statewide, we have fewer than 5,000 acute care beds. Of those 5,000 beds, fewer than 700 are intensive care unit beds and are better equipped to handle the severe cases of COVID-19. Right now, more than 80% of all those beds are occupied with a mix of COVID-19 and other patients. That means we have only 20% of beds available. We have similar limits when it comes to ventilators. Let me be clear, if we do not do everything we can to slow this virus, hospital beds will soon be completely filled with COVID-19 patients. There will be no beds to set broken bones, treat heart attacks, or use for other necessary medical procedures. This will ultimately put Nevada doctors in the same position doctors in Italy are in right now, being forced to decide between treating a father or a son, a mother or a daughter, a cousin or a nephew. Don't put our doctors in that position. Don't put your family through that heartache. Here's how we avoid that. We do what I've said up here repeatedly now. If home means Nevada, we stay home for Nevada. As governor, I've signed declared a state of emergency. I've shuttered schools. I urged the closure of non-essential businesses. I shut down gaming. The last time gaming was shut down in the state of Nevada was when President John F. Kennedy was assassinated. That was for one day. These were the hardest decisions I've had to make. I know that gaming and hospitality is the lifeblood of our state. I see and I feel the damage this is causing. I drive down the same streets that you do. Not only are the casinos dark, but the mom and pop shops, diners, and salons are too. I know the disruption it causes to cancel schools. Our schools are a safe haven for our students, and it's not easy to take that away from our children. Physically, schools are closed, but educators and other school personnel are absolutely essential. Whether they are at home, work sharing lesson plans digitally, whether they are moving mountains to continue food services, whether they are cleaning and sanitizing our schools in preparation for when we return to our normal days. Thank you for this work. It's not easy and ideal, but this is how we must deliver for our state right now. I know that means that I know that this will mean for the future of what this will mean for the future of Nevada. But I also know that if we don't take another step, we will lose many more Nevadans, and we can't afford that in this state. We can't. I won't let my inaction make this crisis worse. I won't look back in the months ahead and say, I wish I did more sooner. So today, I'm taking that next step. Previously, I asked non-essential businesses to close their doors to the public. I am no longer asking them to do that. I am directing all non-essential businesses to close. I repeat, if you are not an essential business, I'm using my power as governor under an emergency declaration to order you to close. I'm signing a new emergency directive, the third I've signed since declaring the state of emergency. This emergency directive has specific regulations and will be available to all immediately after these remarks. There should be no confusion, and there's none in my mind. This is not the time to try to find loopholes. If your business is not essential to providing sustenance and for the everyday safety, health, and well-being of Nevadans, you must shut down so that we can give healthcare workers and our fellow citizens the best chance at fighting this virus that we can. By signing this directive, I'm granting local governments the authority that they do not currently have to impose civil penalties, including fining and revoking licenses of businesses that do not shut down. If businesses defy this directive and stay open, state and local law enforcement will have the ability to treat this as a criminal act after all other options have been exhausted. This directive goes into effect at midnight tonight and will remain in place until April 16th. I hoped it would not come to this. I did not want it to come to this, but to protect all Nevadans, this is necessary. This is our only chance at flattening the curve. That's a fancy way of saying that we need to move quickly and creatively to slow the tsunami that's headed our way. We need to put up strong barriers to ensure the waters don't overtake us. We have to slow down the flow so that our healthcare system can manage this challenge in the short term. Some are saying these actions will devastate our economy, but for a state that relies this heavily on visitors, the impacts are inevitable. It's happening whether we want it to or not. So our choice really comes down to how long we want this to drag on. Is it better to let it linger and hope it resolves itself a while away while our economy continues to worsen and Nevadans continue to get sick and die? That's not what we do. We will choose to face the facts, listen to our medical experts, ignore the misguided leaders, rip off the Band-Aid, and hopefully cut this thing short, knowing that our chances of economic recovery are better if we make this painful decision today. Understanding that the faster we act, the sooner this ends, and the sooner we can all get back to business. Mitigation is the only proven way to lessen the blow and get on the path to recovery. And I've already got a lot of smart Nevadans working on that now. In fact, Nevada was one of the first states to get statewide approval for Small Business Administration disaster loans. That's due to the hard work of the Division of Emergency Management and the Governor's Office of Economic Development. This means small businesses that have suffered substantial economic injury as a result of COVID-19 can apply for low-interest federal loans. I also waived 2 requirements for Nevadans who are out of work to apply for unemployment insurance benefits while they get back on their feet. During this crisis, Nevadans won't have to prove they are searching for work and won't have to wait 7 days after being approved to receive their benefits. Additionally, the Silver State Health Insurance Exchange has opened a special enrollment period for Nevadans to gain access to health insurance. If you need health insurance, do not wait. I want to be clear. Nevada is working on economic recovery, but my primary focus right now is preventing the spread of this virus. I am your governor, and I want the best for each and every one of you. I have worked tirelessly, and I will continue to work tirelessly for you. I can guarantee you that, but we can only do this together. Stay home for Nevada and close your doors for now so we can get them open for business sooner. It feels like the world has turned topsy-turvy. But if, and only if, Nevadans come together and put each other first, can we turn the world right side up again. If home means Nevada to you, stay home for Nevada. Thank you.
Thank you, Governor. We'll take our first question from the Nevada Independent. I am unmuting that microphone right now.
Hey, Governor. Thank you so much for taking questions. Just wanted to ask and try and get some more clarity. Can you explain a little bit more about what kind of penalties that businesses can expect if they remain open after midnight to get non-essential?
That'll be up to local government. Do you want to repeat the question?
I'm going to repeat the question for those who are following along on Facebook Live. The question was asking the governor to clarify what penalties non-essential businesses will face if they stay open past midnight. Governor?
That'll be up to local governments to decide what the appropriate penalties should be, and they will enforce that. If it turns a criminal penalty, it'll become part of the judicial system.
Thank you. Our next question will come from the Las Vegas Review-Journal. That microphone is unmuted. Okay, we'll come back to that. We'll take our next question from the Reno Gazette-Journal. That microphone is unmuted.
Hi, Governor. Can you hear me?
We can hear you, but I'm going to repeat your question for the governor.
Oh, okay. Governor, you mentioned frustration earlier with some of the businesses who did not voluntarily close, and also some of the officials who did not express much interest in enforcing your closure order. Were you thinking of anyone in particular?
The question is asking the governor to comment on the frustration he's felt with businesses that did not voluntarily close and officials who did not want to do that as well. Governor?
I think that the people that have acted inappropriately or misguided and the businesses that have done likewise know who they are. And I am not asking them anymore. I am telling them that they must close their doors or they will face the consequences. As for elected officials, I encourage them to understand the severity of the situation we're facing and become part of the solution.
We're going to try to go back to the Las Vegas Review-Journal right now. We're going to take our next question from Univision or Television if they're on the line. Okay, we'll take our next question from News 4 in Reno. How about Fox 5 in Vegas?
Hi, from Fox 5 in Las Vegas. My question is
Yeah, this is you. I'll send it to you.
Okay, if you have a question, if you could ask a question, we're hearing a lot of background noise. So if you have a question, you want to speak up, we'll take them one at a time. Any further questions? Even if you've asked one, if you have another one.
We're having technical difficulties right now. We're going to ask you all to submit your questions to pressroom@nvhealthresource.nv.gov. We appreciate your patience as we work through how press conferences will run from now on. Again, any additional questions can come through pressroom@nvhealthresponse.nv.gov.
Okay, do we have any further? Are they going to be able to submit them now? If somebody wants to email in a question, I'll answer the question. We get somebody. I appreciate everybody listening. I apologize for the technical difficulty that we're having here with people being unmuted and ability to ask questions. Did we get an email in yet? Okay. If you could email in your questions, I will respond to the questions as soon as possible, and I mean just as soon as in a few minutes. I thank everybody.
From Channel 8.
Okay.
Okay, go ahead with your question, Channel 8. Go ahead with your question, Channel 8.
It's Terry Russell from Channel 8. I'm checking to see with the governor what situation the next phase for him. Is there a next phase after non-essential? Does he see us going into a situation like California?
To repeat the question, we'd like to know what the next phase of this is. Does the governor see us going into a situation like California?
Okay. This is not developing week by week or day by day. This is developing hour by hour. We are analyzing the situation. We're in constant contact with the medical professionals and experts, and we will deal with those questions and those situations that develop in an appropriate and timely manner as they become known to us.
Vanessa Murphy from Channel 8. Can you guys hear me? From Channel 8 in Las Vegas.
Go ahead, Channel 8 in Las Vegas.
Okay, thank you. I have two questions, if I can squeeze them in. The first is, yesterday we heard President Trump say he's hearing good things are happening on the ground. Can Governor Sisolak respond to that and give us an overall picture of the test kits? He touched on that. The second part is, what would he say to people, including leaders here, who argue, well, thousands more die from the flu? Why don't we give that as much attention?
To repeat the question, the governor has been asked to comment on President Trump's comment that good things are happening on the ground, and also about the difference between COVID-19 and the flu. Okay.
First off, I did participate in numerous phone calls with the president, the vice president, and the task force. All I can speak to is what we are facing in Nevada. We're facing a severe shortage. We cannot get appropriate supplies. We've been notified that they're all back ordered, and we're going to have to, as he said, the president said, get them on our own. So we are working tirelessly to try to get them on our own. The flu mortality rate is 0.1%. COVID-19 is spreading at a mortality rate that is much higher than that. The only way we can get a handle on this is to get out in front of this, to stay home for Nevada, and to protect yourself, your loved ones, your family members, your neighbors, and our entire state.
We'll take a question from the Las Vegas Sun.
Hi, Governor Sisolak. You expressed some concern about the lack of ventilators, and I was wondering if you could discuss who keeps track of the ventilators, how many are available in Nevada, and what plans do you have to try to acquire some more?
Yeah, we are.
The question was related to the availability of ventilators and respirators in Nevada.
We are doing everything we can, coordinating with our local hospital partners and health districts to inventory and to share whatever resources we have available. The only thing I can give you that's a certainty is we don't have enough. We don't have enough in any of our hospitals. We've never faced a situation like this before where so many ventilators were needed, and we're dealing it the best we possibly can and trying to acquire them on our own.
We're going to take one more question for the governor. I'm going to pull back up Fox 5 because we didn't get to that question earlier. Fox 5 in Las Vegas.
Hi, this is Tiana from Fox 5 in Las Vegas. How can people report non-essential businesses that are staying open?
The question for the governor was, how can people report non-essential businesses that are staying open?
And I appreciate that question. I hope it does not come to people having to report non-essential businesses staying open. Metro is too busy, and please do not call 911 to report that a nail salon or a hair salon stayed open. They've got other things they have to deal with. I hope and I pray that our businesses and our business leaders understand the magnitude of this situation. First I asked, that didn't work. Then I ordered, if this doesn't work, they will face appropriate civil and criminal penalties as a result of their inactions. That's all I can say. The health and the well-being of Nevadans is more important than these businesses staying open to make a few dollars. I'm not putting a value on these lives. To preserve the quality, the lives, and the people, we're going to shut them down. Thank you all very much for listening and for joining us on this. Again, I apologize. I've never done anything like this on Facebook Live before, and for the confusion, I'll own that. I'm new with this technological stuff, but thank you for joining us, and please encourage not just yourself, but your family and your friends and your neighbors. Stay home for Nevada. Please stay home for Nevada. Thank you. Good evening, everyone. Thanks for joining us on Facebook Live. I'm going to give it just 20-30 seconds to give everyone an opportunity to join in. We just sent out the notification, so hope you're all staying home and staying safe. We'll be back within just a second.